Okay, we're going to do a quick eClinical Works progress note refresh here. Some of you, it's been 5 weeks since you've been in the clinic, so we're going to start. Just take a quick look at what the nurse will have already put in. We'll say this is a new patient, obviously because she's entered in medications, but there's no problems listed under the problem list yet. The nurse will have put in the allergies, the family history, the social history, and the vital signs. So when the provider starts getting into this chart, let's start with the medication list. First thing I'm going to do is rearrange this medication list in the order of priority that I see appropriate for the patient. See, they're on Zoloft, pantoprazole, atorvastatin, metformin, olmesartan, and Ozempic. Let's just start by putting Ozempic at the top. I'm going to start saying that diabetes is going to be our main priority. Our second priority would be hypertension. Third would be the hyperlipidemia. I'll put pantoprazole as fourth and the Zoloft as the last. So we've kind of given this medication list some order. We've grouped some medications together. The first two, the Ozempic and the metformin, are both for diabetes. We can start building our problem list, and let's try to build that also in order. If we go over here to the problem list tab, if you have an established patient, this will already have problems listed under it. In this case, if it's a new patient, let's add problems. And we'll click Add ICD. So the first one we're going to pick is going to be diabetes. You can search it. If you have them saved under your favorites, you can put the star on and look, so we'll look for the favorites. On mine, I have type 2 diabetes in here. So we'll select that one first, and you'll see that goes on the problem list. If you don't have a favorites list yet, or you don't know the code, you can just simply search it up here in the search box, type 2 diabetes. And you may notice that when you get type 2 diabetes, you'll get some different various options that are in here. So you may want to, if you end up picking one of these that is the blue, let's say it's a type 2 diabetic controlled, then you'll have some other drop downs that come in. Usually when I have this many drop downs show up for the first time, I'll just put unspecified. So we'll say unspecified whether there's insulin use, unspecified complications, and that'll get us simplified down here, and we can select this diagnosis. Okay. Now, in this case, we've added diabetes on twice, and we don't need to have both of those on the list, so I'm going to take that second one off. But we do need to add the other problems for the other medications the patient's taking. So let's add hypertension. I'll use essential hypertension. Let's add hyperlipidemia. Let's add gastroesophageal reflux disease. And then let's add depression. So now we've created a problem list, and you'll see that I've arranged the order of the problems to match the order of the medication list. So if we go out of this window, you should be able to draw a line across from each medication to the problem list. The first two medications, Ozempic and metformin, are for type 2 diabetes. The third medication on the medication list is olmesartan for hypertension. Fourth one's atorvastatin for hyperlipidemia. Fifth one's pantoprazole for GERD. And the last one's Zoloft for depression with anxiety. And you'll see we can draw a line across from the medications to the problem list. And you'll see that we've grouped the medications in order of priority. We've also arranged the problem list in order of priority. Now we need to go down into the medical history tab, and you'll see that we've already added the problem list into the problem list panel on the right side. So let's just go ahead into the history and repeat what we just did. Well, problem 1 would be diabetes. Problem 2 would be hypertension. Problem 3 would be hyperlipidemia. Problem 4 would be GERD. Problem 5 would be depression. And we do it this way so that we can make notes under the medical history. So even though we've already entered the problems under the problem list, when we go into the chart medical history, we will free text those problems again, in the same order that we have under the problem list. And we do it this way so that if we need to make some notations here under the history, let's say, for example, this patient is seeing an endocrinologist, we can say diabetes sees endocrinologist Dr. Pepper. And that will show up in our patient note. So in the future, the next person that sees this patient will know that this patient is already seeing an endocrinologist, and we might not actually be managing their diabetes medications. So we have the basic setup to start the chart to go in and see the patient. We can edit any of this as necessary after we see the patient. You want to make sure and go under your HPI, your history of present illness. Under the history of present illness, there's a top section here. Sometimes the nurse will go in here and check some boxes specific to why the patient's here. You'll notice that I typically have the nurse use the pop-up for general complaints, and it'll just say health promotion. It's a very general type of HPI that could apply to almost any type of visit. She may say the patient is here for medication management and lab orders. So you'll see that when you look at the actual patient chart, it'll say health promotion here for medication management and lab orders. Where we would do our part is when we entered the HPI, we would go down into the notes section. There's a small box down here for us to type in notes where we could say this is a 50-year-old male, even though actually I've set this up as a 24-year-old male. We'll say 50-year-old male presents to clinic for med management, lab order, and refills. Patient is on Ozempic and metformin for diabetes. And we proceed to finish our HPI under this notes section here. If you need more space, you can always click this blue arrow and give you more space so you can see what you're writing. When you X out of that, you'll notice that now what you've typed appears in that box. Under the review of systems and the assessment, you should have a template by now. You've all been with us for 1 week. We may use this general review of systems and physical exam. You can get to the templates either from the right chart panels that are over here, or you can get to it from the bottom where it says templates. If you click down here at the bottom where it says templates, you'll notice there's generic templates. This is ours, the general review of systems and physical exam. If the patient's been seen before, you can go to the patient specific, and it will have some previous visits listed under here the patient's been seen before that we can merge into the chart. In this case, it's a new patient, so we'll just go to the generic. We'll select the general review of systems and physical exam, and we'll merge in the review of systems and the exam. You'll see now in the note the review systems. This is a negative review systems merged into the note, and a negative physical exam review merged into the note. You can go back and make changes as needed when you're talking with the patient. Let's get down to the assessment now. The assessment, if we're trying to chart with time in mind and we're trying to be quick about doing the notes, I would say there's the couple tips you can do to get your assessment in here fast. One would be you could go over here to the right chart panel where you see these red arrows, and you can click these arrows individually and add them on one by one. You'll see I just added type 2 diabetes, and now the arrows turn blue. If I add on hypertension, that arrow will also turn blue. It's been merged into the note today. Another way to accomplish that, let's say you wanted to add in all of those problem lists to today's assessment. There is a small arrow right over here. Instead of clicking individually on these arrows, you can click this small arrow over here. That blue arrow will merge in all the assessments. Another place that you don't want to forget about that you can find assessments is under this little tiny yellow upside down triangle they call a caret. If you click on that caret, it will show you past visits where they've come into the office. So the caret can save you a lot of time. If you don't use the problem list panel to the right here, you can quickly look under the caret on the assessment, and you can say, let's see what they were here for the previous visits, and you can grab those assessments and merge them into the chart. For now, I'm going to close that. Remember, these carets are in different places throughout the note. So if you scroll up to the HPI on an established patient, you could do the same thing on the HPI. If you see a caret, click the caret, try to find the past visits the patient's been seen for, and you can actually copy and paste the notes from the previous encounters. Going back down to the assessment, though, we've added in the current problems from the problem list to the assessment. This patient is going to be here for labs and refills, so let's go to treatment. Under the treatment tab, the first thing we'll do is go ahead and order this patient's labs. So let's go up to the beaker. You'll see on these icons up here at the top panel, let's click the beaker, and we'll click on our favorites. We've built a favorites list that we use pretty frequently. Before we start to click the labs we want to order, let's click select all. Select all the assessments. We'll do a CBC, a CMP, an A1C, lipid, TSH, and a urinalysis on this patient. If we're transmitting these to the lab, once we see that they're in today's orders, we would hit send. If we're just going to close it and allow the supervising provider to transmit the lab order, then we would hit close. For now, I'll hit close. But in a real patient, we would hit send so we could print out the lab order and the patient would take the print copy of the lab requisition over to the lab. So you'll see we've added in all of the labs. Now let's add in the medications. If we go up to the RX tab, this is the most difficult thing to find in all of eClinical, where you add prescriptions. When you're under the RX tab, you actually have to select this little tiny RX right here. And you'll see that it will default to the Add New Medication tab up here on the top right. Let's pick Medication Summary so we can see what the meds the patient is already on. We can go down our list of assessments and add these medications to today's assessment one by one. I'll start with type 2 diabetes. I'll say we're going to continue the Ozempic and metformin since we put this patient sees an endocrinologist. When we get to hypertension, we'll put either refill, 30-day refill, or 90-day refill. For today, I'm going to put just hit refill. Same thing with hyperlipidemia. Under that assessment, we'll put refill atorvastatin. And under GERD, we'll put refill pantoprazole. And under depression and anxiety, we'll hit refill Zoloft. So you'll see that all of those medication refills have been added on this page. We need to make sure before they can be transmitted that we click on the medications and make sure that it has all the instructions. So we need to make sure we have a duration, a dispense, and a refill. So we can quickly go through here and say 90 days, one refill, save and next. The next medication, atorvastatin, let's say 90, and one refill, save and next. Pantoprazole, again 90 with one refill, save and next. And then Zoloft 90 and one refill, save and next. So now all of those medications have been added. So if we hit send RX down here at the bottom, send RX, we'll notice that when this box comes up, if everything is set up appropriately, there should be no alert. On this patient, there's an alert because there's no pharmacy listed under here. Typically, when we see an alert, it will be because all of the instructions are not listed. So if you forget to put in the number of days or the dispense number of tablets, you might see an alert here. In most cases, the pharmacy will already be filled out because the nurse will have put in the pharmacy. But since there's no pharmacy listed under the Send To, let's go ahead and make up a pharmacy in here. We'll just say Randall's in Lake City. The pharmacy has been selected, so I'm going to apply that pharmacy to all of these prescriptions. And you'll see that now the alert is gone. You'll also see that it says they haven't been sent yet. So if we wanted to send these prescriptions, I would need to click send down here. I'm not going to do that since this is not a real patient. But just so you see the way the alert is gone. So that it's ready to be sent to this pharmacy listed under Send To. I'm going to go ahead and get out of this box. Discard the changes for now. When you're finished with the treatment, the assessment and treatment, the only thing left to do is to code the visit. So if we go to the billing, you'll see on the top panel, the billing is this little graph. I think it's supposed to represent an old super bill. So when you get to the billing page, you'll notice that you have the list of assessments for the day. We need to designate the number 1 as the primary, put an X in this box here. So assessment's chosen as the primary. And then we would hit E&M coder. Under E&M services, there's really only 2 sections you would use on this. It would be either E&M for an established or a new patient, or preventive care for an established or a new patient, or Medicare. Preventive care would be what you would use if this was for a physical or an annual wellness visit. E&M services, what would you use for a regular office visit, for a problem-based visit, a med management visit, for refills, anything else. So in this patient, it was a new patient, and we'll select a 99203 for a new patient. Okay, if it was an established patient, we would usually select a 99214 for this type of visit, and then we'd say okay. And you'll see that now it has a CPT code of 99214 listed with the office outpatient visit, with all the diagnosis codes are listed under ICD 1, 2, 3, and 4. That's the ICD codes for the assessments we added today. We could just simply say under follow up in 2 to 3 weeks as needed for lab results. And when you're finished with the note, you would either close it or hit done. If you were to hit close, you would see when you went back to the schedule, there would typically be a stethoscope here where when the nurse puts the patient in the room, it leaves a stethoscope that shows that the note is in progress. However, if you were to hit done under the visit code, if you were to hit done, you'll see there's a check mark. If you hit done, it will put a check mark, and it will show on the notes over here on your schedule, the check mark is indicating that that note is complete. Once that note is complete and there's a check mark, that lets the supervising provider know that we can lock the notes when we lock our notes at the end of the day. So this is just a quick refresher. Again, if you have any little individual issues come up over the day, get with me and we'll go through them one by one so we can get you back up to speed. And hopefully the second go around here, we're kind of already off the right foot and we can get through some notes faster. We'll continue to work on it and get better as we go.